of all of my experiences coming to the Cincinnati Children's Hospital, and there have been numerous, really, what I just talked about previously with my daughter breaking her arm, that was really my only good experience. Back in 2008, I believe, maybe 2009, actually it's 2008, my son, I have 2 children with Arnold-Chiari malformation. They both have had multiple decompressions, multiple brain surgeries with neurosurgery and Dr. Carrie Crone. My son Dylan, who at the time was, I think 4, had another decompression. We had to put a stent in the 4th ventricle of the brain and had to do a lot of manipulation of the brain. He was very, very ill post-operatively. Very ill. It was a 10-day stay in the hospital, maybe 2 weeks. We were discharged for a couple of reasons. One, he was starting to get better. The consensus was maybe he would continue to improve at home. We were a little bit concerned that he wasn't eating. His belly was a little bit distended. But the discussion was, my husband, Dylan's dad, is a general surgeon. Obviously, we felt like from a medical perspective, he could be cared for at home as well as, in the hospital, but we thought maybe at home was the better place. We went home, and about 48 hours after we got home, we noticed his stomach was getting even more distended, and he started to go into acute pain, laying on the bathroom floor, screaming, crying, just in unbelievable belly pain. And he looked like he had a watermelon on his stomach. My husband, we ended up calling Dr. Crone, spoke directly to him. The decision was, you need to go to the ER. We're going to go to the ER. Dr. Crone was going to send his fellow down, Neil Patel, who is going to meet us in the ER, immediately evaluate him, start ordering some tests, but we need to determine what's wrong. We wanted to get the pain under control because Dylan had an incision in the back of his head, which was was a couple inches long, and whenever you have brain surgery, when you are crying, when you're in pain, it increases the pressure in your brain, and in this case was putting a lot of pressure on a very fresh incision. So we're severely concerned about the incision opening. So we come to the ER. They signed us in, and Dr. Patel immediately took us back. We went through get the vitals, but he immediately took us back to a room. In the process of walking back to a room, we go in the room, and I believe she was a fellow, a physician comes in, does not introduce herself to myself or my husband, asks Dr. Patel to immediately step aside and starts pushing on our son's belly. And he is screaming even louder at this point. I immediately ask her to introduce herself. Dr. Patel at that point is saying, wait a minute, please do not touch on her. Please do not touch on his belly. You're making him cry harder. We need to get pain meds in this kid. We've got to get the pain under control. We are concerned about this incision opening. She kicks Dr. Patel out of the room. Proceeds to tell him that he is not providing care, he is not a medical professional caring for this child, and that his services are no longer needed. My husband at that point stands up and says, I am a general surgeon, I am this kid's father, this is what we need to do. I would like Dr. Patel to come back in the room because he is overseeing the care of my son's head, and we need pain medicine administered immediately, as well as he rambled off a couple of tests that needed to be done and asked for a general surgeon consult. That physician then told my husband he was no longer welcome in the room and told him that he needed to leave the room as well, and that nobody was going to administer care to this child till those 2 individuals left the room. Being the mother that I am, and very protective of my child, I immediately got up. I told her to get out of the room. I told her she was fired from the case, that she was not to be providing any care or making any medical decisions for my child, that I wanted an attending in the room immediately, and that I did not want to see her come anywhere near my child again. I was then immediately asked to leave the room, which I did not do. I sat on my son's bed, and in the time, this is probably a 15-minute argument. My son's head, now where his incision is, looks like there's a golf ball sitting there, and we now have clear fluid coming out of the incision, which means we have CSF fluid leaking. We have an issue. At this point, I was out in the hall demanding that an attending get in the room immediately. She left. An attending, I believe it was an attending, came in at this point. Tests were ordered, pain meds were administered. My biggest issue was we missed 15 minutes of care for my child. That could have easily been administered if we did not have an arrogant, cocky fellow who thought she was more powerful than anybody else that was there. There was no team approach. There was no acknowledgement or communication with the parents. There was no introduction of herself to the parents. There was a complete lack of respect for myself, my husband, the patient, as well as Dr. Patel, who is a fellow physician in the hospital, as well as Dr. Carrie Crone, who is our neurosurgeon, who is an attending neurosurgeon in this hospital. You had a physician who is a general surgeon as a parent. That could have been a perfect opportunity to join together and maybe see what the dad thought, talk to the neurosurgeon who had just operated on the kid and was referring him in, what were their concerns, and addressed everything. I think if you take those two situations and you compare them to my good experience, the underlying experience of all of the bad is not introducing yourself to the parent, not acknowledging the parent's concerns, issues, not addressing the child, not acknowledging the referring physician's concerns and issues. From a parent's perspective, I was not coming to the ER. I mean, I would much rather go to a Mercy ER or a Westchester UC ER, Good Sam emergency room, versus bringing my child here. And that's sad because this is a children's hospital and this should be the only place that children come to receive emergency care.